What was daily life like during the Antonine Plague? Have you ever wondered how people lived during one of the most devastating health crises in ancient Rome? The Antonine Plague, which struck the Roman Empire from about 165 to 180, transformed daily life for millions. This epidemic, likely caused by smallpox or measles, brought high fever, diarrhea, skin eruptions, and sore throat, often leading to death. Imagine living in a time when fear and suffering were part of everyday life. In Rome, the plague caused deaths that could reach up to 2,000 per day during severe outbreaks. This constant threat made people anxious and cautious. Many avoided contact with the sick, and those showing symptoms were often shunned. Homes of the infected were frequently abandoned to prevent the spread of the disease. And like today, there were no quarantines or organized emergency supplies to help those in need. The wealthy had the option to flee to countryside villas, seeking safety from the disease. However, the urban poor had no such refuge. They faced the brunt of the epidemic, suffering greatly with limited access to health care. The Roman healthcare system was not equipped to handle such a crisis. There were no systematic disease screenings or organized responses to the outbreak. The impact on the Roman military was significant. With many soldiers falling ill, the number of available defenders to protect the empire's borders decreased. This decline in military strength, combined with the loss of citizens, strained the economy. Labor shortages affected agriculture and trade, leading to slower public building projects. As fear spread, many turned to religion for comfort. People sought protection and healing from the gods. Emperor Marcus Aurelius responded by investing in the restoration of temples and shrines, reflecting the spiritual response to the crisis. The Antonine Plague not only affected health but also led to political instability and long-term demographic changes in Roman society. Psychologically, the plague took a toll on individuals. The ever-present threat of death led to despair and fatalism. Some accounts describe people withdrawing from normal life, refusing to eat or drink, preparing for their end. Daily life during the Antonine Plague was marked by illness, death, and social disruption. It was a time of fear, suffering, and a turn toward religious consolation. The effects of this epidemic shaped Roman society for decades, leaving a lasting impact on everyday life.